right, time now for our Health Watch. Dr. Syed Hussain from Trinity Health of New England is joining us once again. Good morning. Thanks so much for being with us.
Morning. Thank you for having me.
Love having you here. You always sift through a lot of the medical headlines that people at home are seeing in their web searches, and you really kind of break down a lot of important information for us, so we appreciate that.
Thank
First,
you.
let's talk about what's happening with the U.S. task force. They say that doctors should help kids with obesity issues if they're finding that they're overweight, but not through medication or surgery. So let's talk a little bit more about this.
Yeah, these are draft guidelines being proposed by the United States Preventive Services Task Force, Erica. It's not final yet. It'll be open for public comment for 4 weeks before the USPSTF actually takes a vote to see do we move forward with it. Basically, in essence, it's a change from the last time this was updated in 2017 and basically reflects new evidence that we know has come up related to obesity, childhood obesity in particular. We know it's a growing problem in this country. 20% of children can be obese. And so that will then carry on into their adult life. The initial thinking was, okay, they may outgrow it, but that's not the case. That's not true. More and more pediatricians are seeing adult-related diseases, whether it's high blood pressure or diabetes, type 2 diabetes in children who are obese.
So what should parents be doing? Because sometimes it can be tough because kids go through different stages with their weight. Right.
So the guidelines are recommending that first and foremost, have your child get that annual wellness check with your pediatrician. The way obesity is measured in children is slightly different from adults. So in adults, it's usually a BMI of 30 or higher. In children, if your child is above the 95th percentile in that age and gender category, they are considered obese. And the guidelines recommend intense behavioral therapy. So a lot of different lifestyle changes and modifications. They don't recommend surgery or any diet, any medications, for instance, which is a little bit of a difference from what the American Academy of Pediatrics suggests.
All right, let's talk a little bit about chronic fatigue syndrome. It affects millions of Americans every year. I mean, this is a very stressful, busy time, so maybe it gets ramped up a little bit more during this time of year. But what are the treatments for that?
Yeah, there is no treatment. There's no cure, Erica. This is a diagnosis of exclusion. More research is needed. So the CDC now is shedding light that more than 3 million Americans may actually suffer from this. And the characteristic feature of this syndrome is just severe exhaustion for more than 6 months that is not relieved by bed rest. And activity or work actually makes symptoms worse. And those symptoms can include pain as well. So more is needed to learn more about this, but the numbers have probably increased because of long COVID as well. We know long COVID is an established diagnosis where COVID symptoms may linger for several weeks, months, or even years.
And we all feel tired, but this is something much more extreme than that,
Absolutely,
right?
absolutely.
You have to see your doctor for that, right?
That's right.
All right, let's talk about these new gene therapies for sickle cell. This is really incredible and great.
Yes, absolutely. Very, very exciting. Now, remember, there are about 100,000 patients that have this debilitating sickle cell disease in the U.S., which can cause pain, it can cause strokes, heart problems. And right now, there's the treatment includes either a bone marrow transplant, which again comes with its own complications, or frequent blood transfusions. So in those patients that have severe sickle cell disease, that's about 20% of them, may qualify for this gene therapy, which actually may resolve their underlying condition, which is potentially a game changer. So I'm very excited to see how this evolves. There is data that the FDA looked at from the two studies, the two modalities that got approved by the FDA.
But the insurance is going to be the real problem here, I think, right?
As always, they will need to cover, as long as it's FDA approved and there's, guidelines around who will benefit from this therapy.
Right, because if it's not, that's going to certainly very, very pricey.
That's right. It is.
Well, thanks so much, Dr. Hussain. We always
you.
appreciate you coming in.
Thanks for having me.
Great information.
Thank you very much.